Thank you for joining us. We hope you find this presentation useful. This is the UC San Diego Kidney Transplant Information Meeting Overview. The main ideas of the meeting will be highlighted. Kidney failure is an epidemic in the United States. Over 500,000 people have kidney disease, and over 100,000 are listed for transplant. Every 20 minutes, a new patient is placed on a transplant list. Patients with kidney failure have several options to replace kidney function. One is dialysis, either hemodialysis or peritoneal dialysis. The other is kidney transplant. Patients typically stay on dialysis while waiting for transplant. So why choose kidney transplant? In general, patients live longer with transplant than patients who remain on dialysis. They have a better quality of life than patients on dialysis, and they have better overall health when compared to patients on dialysis. The drawbacks include that it's a major operation with potential for complications. The anti-rejection medications come with side effects and can be expensive depending on insurance coverage. And lastly, kidney transplants last on average about 10 years. After that, patients can be returned to dialysis or are referred for kidney retransplant evaluation. Another point to consider is that transplant is not for everyone. Patients who are of advanced age, frail, or have several other medical conditions may do worse after transplant and may be better remaining on dialysis. Transplant is contraindicated with active cancer, severe heart disease, severe blood vessel disease, morbid obesity, and other diseases. And lack of compliance with medical or dialysis treatment and lack of social support can be barriers to transplant. To be listed at the UC San Diego Center for Transplant, patients must be able to stay in San Diego for 6 weeks up to 3 months after surgery if they don't already live in our county. Our center does not pay for housing during this time. Patients will need to save money to stay in San Diego. Patients' caregivers must be with them the entire time. And patients must have reliable transportation while in San Diego. Patients may need to return to San Diego for additional testing after this period if medically necessary. Now, let's talk about the transplant evaluation process. Transplantation is a team effort. It's truly a team effort consisting of physicians, coordinators, social workers, nurses, dietitians, pharmacists, and of course, patients and their caregivers. Here's a current picture of our team. Here's a slide showing the names of the RN coordinators, assistants, social workers, and dietitians. Each patient is assigned a coordinator to help them through the evaluation process. On evaluation day, which are typically Mondays and Thursdays, patients are in clinic for between 4 and 5 hours, meeting with social work, dietitian, transplant nephrologists, transplant surgeons, and sometimes labs are drawn. Here's a slide showing the professional evaluations for social work and dietary. Here's a slide that shows the physician evaluation, which includes the transplant nephrologist and the transplant surgeon. And the next slide, which shows the medical evaluation, mandatory and possible testing. So what happens after the evaluation? You and your referring physician will receive a letter outlining what further tests are needed. The testing and the consultation must be completed at UC San Diego unless your insurance will not allow it. Patients typically have around 6 months to complete any further testing. And once the testing is complete, a patient's case is presented to our selection committee. Kidney Transplant Selection Committee is a multidisciplinary group that is held twice a month. Each patient's case is discussed and reviewed in detail, and the group decides on an outcome, either approval, denial, or deferral. And once that decision is made, a notification is made to the patient within 10 days. Additional approval is necessary for placement on the UNOS, the United Network for Organ Sharing, waitlist. For patients who are approved for listing, these are the recommendations. For patients to stay as healthy as possible, including eating well, exercising, and maintaining a healthy weight, staying up to date with health maintenance, with examples including mammograms, colonoscopies, well woman exams or pap smears, and or prostate exams, getting yearly stress tests if needed, and coming in for clinic reevaluation when requested. Our center recommends helping your coordinator as much as possible by letting him or her know if you develop a new medical problem, have surgery, or get admitted to the hospital, receive a blood transfusion, move, get a new phone number, change dialysis units, change nephrologists, or change insurance. We would like our patients to complete testing in a timely fashion. The kidney transplant allocation system is managed by UNOS, the United Network for Organ Sharing. UNOS is a nonprofit organization that manages the nation's organ transplant system under contract with the federal government. Kidneys can come from deceased donors, which are kidneys from donors who have suffered a catastrophic brain injury. Kidney donors can come from living donors, which include living-related donors, living unrelated donors, and what we call living non-directed donation. What that means is some individuals donate a kidney with no recipient in mind and out of the goodness of their heart. So how long will patients wait for a kidney? The red line on the graph shows the number of patients who need a kidney and how that need has steadily increased throughout the years. The additional lines on the graph show the number of donors, and those donors have not increased in line with the amount of need. So what that means is patients are waiting longer and longer for a kidney. This slide shows the estimated wait times for deceased donor kidneys. This table shows the national average versus the average at our center versus the average at a Los Angeles-based program. These wait times are further categorized by blood type, with blood type O having the longest wait and blood type AB having the shortest wait. As patients can see, the wait time between the national average and the UC San Diego average is higher, but a little bit lower than a Los Angeles-based program. These statistics from our center are from the last 2 years. As mentioned previously, UNOS, the United Network for Organ Sharing, provides guidelines and protocols regarding who gets what kidney, and those guidelines are called the Kidney Allocation System, or KAS. Waiting time for kidneys depends on blood type, where patients live, and antibodies. The level of antibodies is determined by a lab test. Patients are ranked by the amount of time they've accrued since starting dialysis or listing. The top 20% of donors are allocated to the top 20% of recipients. And there's a separate wait list for the remaining group of kidneys. The kidney allocation system is a complex process and will be explained more in detail during our Kidney Transplant 101 class at our center. So how can patients get a kidney sooner? 1 is living donation, which we will discuss more in detail later on. 2 is patients are allowed to and encouraged to get listed in another state with a shorter wait time. 3 is a directed donation. 4 is a special group of kidneys called KDPI, greater than 85%. And 5th, patients can consider accepting a kidney that is categorized as increased risk. And we will go through the details of that at a later slide. Let's discuss the KDPI, or the Kidney Donor Profile Index. The KDPI is a score between 0 and 100, and the calculation includes variables such as age, height, weight, ethnicity, history of hypertension, diabetes, cause of death, their serum creatinine level, the Hep C status, and the DCD status. Kidney Donor Profile Index, or KDPI, greater than 85% represents a group of kidneys for which our center would like certain recipients to consider. At our center, we highly scrutinize these kidneys and only use the best kidneys in this group. For our potential recipients who are over the age of 60, or have diabetes or heart disease and are over the age of 50, have high antibody levels based on their labs, and other patients who would like a transplant sooner, knowing that it might not last as long, we would like our patients to consider kidneys from this group. Another concept for patients to consider is to think about kidneys that are flagged increased risk, meaning increased risk for transmission of HIV, hepatitis C, and hepatitis B. This diagram shows the different categories that can flag a kidney as increased risk in order of risk. About 20%, or 1 in 5 deceased donors in the United States, fall into this category. Patients might ask themselves why we would want you to consider an organ from this category. These are often very high-quality organs from younger donors. By considering kidneys from this category, patients may shorten their wait times. This next slide shows increased risk donors and the testing that UCSD performs on these donors. We conduct very sensitive nucleic acid testing, or NAT testing, on these donors, and we only proceed when the NAT testing is negative. The risk for transmission of HIV, hepatitis C, and hepatitis B is very low at less than 1 in 1,000. Drug use by donors does not affect the quality of the kidney, and drug use by the donor does not make patients more likely to become a drug addict. These concepts will be discussed more at our Transplant 101 class, and questions can be answered at that time as well. Hepatitis B virus. Patients may be offered a kidney from a donor exposed to the hepatitis B virus but is not infected. If patients have been immunized against hepatitis B, according to our infectious disease specialists, there is virtually no risk of transmission. As mentioned before, patients will have labs drawn and antibody levels will be determined. Antibodies are formed when a patient is exposed to blood or tissue that is not their own. Reasons for high antibody levels include pregnancy, transplantation, or blood transfusion. Antibodies can cause rejection. Patients' antibody levels will be tested as part of their evaluation, and patients with very high level of antibody levels will get priority on the waiting list. Living donation and paired donation. Why might someone consider living donation? Living donation can decrease the wait time for a kidney transplant. Research shows there is improved kidney quality over deceased donation. Some patients can obtain their transplant before starting dialysis. And living donation surgeries can be scheduled ahead of time. And lastly, there's less risk of infectious disease transmission through living donation. This slide shows the kidney graft survival statistics over 1 year, 5 year, and 10 years, comparing deceased donors with living donors. And as you can see, the living donor column on the right-hand side does show increased graft survival rates versus deceased donors. Living donors can be friends or acquaintances. Living donors do not need to be a blood type or antibody match. Living donors can have a varied past medical history, and a full head-to-toe evaluation is conducted. Living donors can live anywhere in the world, and the hospital costs, the evaluation costs, and the transplant costs will be covered by the recipient's insurance. The process typically takes about 6 months, and confidentiality is strictly enforced. This diagram shows how a living donor nephrectomy or removal of kidney is done using minimally invasive method. Utilizing this method gives minimal surgical scarring with average hospital stay of 2 days, and patients are able to resume a normal active lifestyle in about 6 weeks. Another method for removing the kidney is through robotic nephrectomy. Paired exchange is also known as a kidney swap. If a living donor is not compatible for their intended recipient, they are matched with another recipient-donor pair. When patients have a donor but are not a blood type, age, size, or antibody match, the patient and their donor can be entered into the NKR, which is the National Kidney Registry. UC San Diego belongs to the National Kidney Registry. The National Kidney Registry has done over 1,600 total paired transplants, with 360 done last year. 91% of patients listed with an unmatched pair get transplanted with a good match. There is no increased risk transporting the kidneys. UC San Diego has special marketing materials for our patients and their friends and family. These packets will be reviewed at your kidney transplant evaluation. If patients have a donor, the first step is to have their donor go to ucsdlivingdonor.org to fill out a brief health questionnaire. Any potential donor is also encouraged to call our main number for more information. This diagram shows where the transplanted kidney goes in the body. The donor kidney is placed just above the groin, with the kidney artery and vein connected to the corresponding vessel in the body. The ureter is connected to the bladder, which means the patient will have normal urination. Patients who receive a transplant will be taking immunosuppression medication for the life of that kidney. The immunosuppression medication prevents rejection of the new kidney. Patients take those medications as instructed without skipping or changing doses. Patients get their blood drawn when instructed so that we can closely monitor kidney function and medication levels. Patients are given a medication action plan, which shows the medications that patients need to take and when to take them. A transplant pharmacist is available to help and teach patients about their new medications. Rejection of your kidney transplant can cause kidney failure. As mentioned previously, patients must take medications every day for the life of that transplant. If patients demonstrate that they are unable to reliably take medications, patients might not qualify to be listed for kidney transplant. When patients are called in to UC San Diego for their transplant, patients may still be sent home if new health problems arise or if there's a problem with the kidney. The average hospital stay is about 5 days, and it is expected that our patients stay in San Diego for 6 weeks up to 3 months. If patients are not able to stay in San Diego, we would be unable to list those patients in our program. Remember, there are limited housing options. Patients must raise funds so that they can be able to stay in San Diego, and patient's care partner must stay with you the whole time. During the class, the UC San Diego kidney survival statistics will be reviewed, including 1 month, 1 year, and 3-year kidney survival rates. This slide also shows our newly opened Jacobs Medical Center. Thank you for joining us. For more information, you can call our main line or go online at https://health.ucsd.edu and type in kidney transplant. Please remember, the viewing of this presentation will not take the place of attending Kidney Transplant 101.